Good afternoon. I'm Terry Scoggin, the Chief Executive Officer of Titus Regional Medical Center in Mount Pleasant, Texas. Today is February 3rd, 2021, Wednesday. It's time for our COVID-19 update. So we're excited to continue to report that the numbers continue to stay at the same level and drop a little at the same time. So we're sitting around that 15 plus or minus during the day, a couple more here, a couple down here. Still having people come through the ER with COVID. We're still seeing it. Last night was pretty hectic in the ER. Of things that were coming through. So we're still seeing it. It's not going away, and we've talked about that for the last week, but we haven't seen that spike up. So as we look at the numbers and look at a regional perspective, this is what we like to see, and this is as of February 1st, which will be into Business Monday. Doesn't have a little bit of a spike that we saw yesterday in it, but for February 1st, you can see 4-5 days in a row now that are below the 15% for our region. So as a COVID hospitalized patients, as a percentage of total hospitalized patients. And you can see we're dropping down there. Not the lowest number we've had, but at 13.18, it's the second lowest we've had since December 28. So that's a good sign for our region to continue to see that go down. You can see there, this is the Tyler region. So just south of us, you can see that they're going down. And they're sitting right now at a 14.74. So 4 days in a row for them under that 15% mark. So that's a good sign to our friends and neighbors to the south. And then to the west of us, didn't have the numbers the other day, but have them today. We have the Dallas region. And you can see they're excited a different way. They're excited they're at that 18.25. So they continue to see that decrease, but they're outside the 20% and down in the 18. So it's a positive for them. When we look at total beds and we just look at the number of beds, you can see that one continue to drop down, and then at the end of business yesterday, the day before, we were at 134. So on Monday night, those numbers were produced yesterday. We would drop down to 134. Would expect, just depending on how other people in the region, us to go up when we get the numbers today for tomorrow. But you can see significantly down from a regional perspective from the 24th of January at 177 to 134, and almost 20 ICU beds. So you're looking easily almost 20-30% decrease over the last few weeks. So we continue to see that decrease. We continue to see we have ICU beds available. At some point in the next few weeks, I'll be excited when we have ICU beds available higher than ICU COVID patients. And that'll be a good number for us to see as they get closer and closer. The Tyler region is consistent to ours. As you see, over the last 2 weeks, it go down to 430, and that's their lowest number of beds, which was into business for yesterday. And then ICU beds as well, and they hit their lowest number down to the 121. So theirs haven't dropped from an ICU as much as ours, but you can see that one continue to decrease. And then Dallas, just look at the numbers there, down. It dropped below 3,000 earlier this week, so that was exciting. I know they had to be pumped about that. But you can see their ICU beds from 853 to 691 continue to decrease. So we are starting to see it. We are seeing that information with the COVID, starting to see just, are we breaking through? I will encourage you, we just got off a conference call that a few minutes ago, and we can still see the impact from a rural community. We can still see other rural communities still suffering COVID and then going through it. So from a vaccine perspective, and giving everybody the update because it's the hottest question, we still haven't heard from a Northeast Texas perspective from the state. I do want to take a second and thank Senator Brian Hughes, Representative Cole Hefner, for their assistance in helping not only Titus Regional Medical Center, but Titus County and Northeast Texas as much as they can with the vaccine. Both of these men and their staff and team have gone above and beyond about helping us set up the meetings and sending letters of recommendation to the powers that be in the state, up in DISH, up in the governor's office. They've gone above and beyond, and we truly appreciate Senator Hughes' office. And then I got a chance to see Cole this Saturday. Just happened to see him at the Hot Links when we're getting Hot Links. So not a better thing to do a vaccine discussion is to eat Hot Links and talk about vaccines. But I did that before I started my diet. But I truly appreciate these two and what they've done. Again, if you get a chance to see them, or if you drop them a note to Facebook, just tell them how much you appreciate not only they're doing for us, but for Northeast Texas. They're two great men, and we truly appreciate their support. Please continue. If you go to our website to look at vaccines, we're still tracking the number. We're unable to let people know just right now if we'll have more. At this point, we don't have any more. At this point, we don't have our second doses for the last 700. And I'm watching other regions, I'm still nervous about it. So as we get more information, again, I've promised this medium that we will be transparent and we'll continue to get that information as we get more. I talked a few seconds ago, had the privilege just a few minutes ago. We just got off before we started this presentation. But we had an opportunity to work with the American Hospital Association this afternoon and talk about rural America and talk about vaccines, talk about the COVID experience in Northeast Texas compared to the experience in South Dakota, Tennessee, one of the Indian reservations in Arizona. It was a good conversation. The one thing I saw in that kind of wanted to talk to you guys about was just the disparities between rural and urban when it came to COVID. The percentage of increase in COVID in the rural areas as a per capita compared to the urban, and then the mortality rate in the rural areas compared to the urban areas was much higher when they showed those numbers. We continue to do everything we can here at Titus Regional and Northeast Texas, and I truly appreciate our doctors, our administration, clinical staff, Kathy Griffiths, Cynthia Gaddy, Patty Beckman, Ruth in pharmacy, and everyone involved from the clinical side who are partnering with our doctors, Dr. Downey, Dr. Thurman, Dr. Akbar, the chief of staff, our MEC. So many people get together each week. But I could see the difference in what our physicians in this health system, on this medical staff have done compared to other regions across the United States. I felt blessed. This has been a horrid experience, and it's just terrible when you think about everything we've gone through over the last 10 months now. But you're also blessed at the same time when I talk to other regions and go through some of the issues they've had and talk about some of their challenges, and I look to our doctors and say, no, this doctor did this and this doctor did that. So I just want to pass that on to this community so you guys know from our perspective. As a community member, I sit alongside you during this process, and we are grateful. We're truly grateful to our physicians and everybody in this region. As we get closer to Friday and throughout the month, this is the American Heart Association. Friday is National Wear Red Day, and so I would encourage, if you have the opportunity, to wear red. Wear red on Friday. I'm going to go in my closet, make sure I have a red shirt. If not, I'll be shopping tonight to wear red on Friday. So wear red for women this Friday, and please post your pictures. Please tag Titus Regional. Please check us out on Facebook, and we're going to do some red pictures throughout the day, and we'll do something red. Maybe Bobby D can have me a red background on Friday or something in memory of this or in honor of this. So please wear your red shirt or out to Herschel's, wherever you're going around town, and we truly appreciate your support of not only from a COVID perspective, but your support for what we're doing related to cardiovascular disease in this community and supporting the cardiovascular service line at Titus Regional. Again, I just want to thank you for your support. Thank you for everything done. We'll meet again on Friday, same time that we've been doing. We'll keep this time because it works. And thank you for your support. God bless.